Years ago, patients would dread the thought of going to the dentist just to avoid those shrieking sounds of the drill and the radiation exposure from the x-rays. Well, technology in dentistry has become available that makes going to the dentist a much more pleasant experience. We're at South Florida Laser Dentistry right here in Tamarack, Florida, to talk with Dr. Seth Pomerantz and his staff. You know, Dr. Pomerantz was one of the first dentists in Broward County to use dental laser instead of the drill, and that was more than 15 years ago. We're going to find out just what laser dentistry is all about and some other major advancements in dentistry that can make your visit to the dentist less stressful and a lot more pleasant. So Dr. Pomerantz, tell us why you decided to use the laser here in your dental office.
I always like technology, and I always like a technology that results in an increased patient result and comfort level. And the dental laser does both. I was intrigued when I first saw the dental laser back in 1997 during a live demonstration. And after some research, I realized this is something I really want to incorporate into my office.
When would you use the dental laser as compared to the drill?
The dental laser can be used for restorations for fillings. It can be used to disinfect the tooth during root canal procedures. It can be used for minor gum surgeries. It can even be used to eliminate the pain associated with canker sores.
When you use the laser, do you have to use anesthesia?
Very often anesthesia is not used, and patients really like the fact that they don't have the prolonged sensation of the numb sensation that they have when they leave the dental office.
So tell me what the other benefits are to using the laser.
Well, because for the majority of the patients we don't need to get them numb, dental visits are quicker. We don't have to wait for a patient to get numb. In addition, the laser cuts with pinpoint accuracy, so we can be more conservative. It sterilizes as it cuts and leaves for a better bond when we place restorations in the tooth.
I really liked the procedure using the laser. Dr. Pomerantz did a filling for me, and I was absolutely amazed at the new procedure compared to the old vibrating drill that created heat and pain. And in this procedure, there was absolutely no discomfort.
Doctor, you built this office to your specifications. I noticed there are some areas that are wide open. What was your thinking?
Well, we designed the office with the sterilization room centered in the office with glass. We want patients to see our extensive process in sterilization to make them more comfortable, to know that their safety is paramount to us. We perform all phases of dentistry in the office and have a periodontist and oral surgeon on staff.
As a dental hygienist, one of our priorities is to teach patients to practice good oral hygiene, especially patients who have underlying health concerns such as heart disease and diabetes. One of the ways that we can make patients feel more comfortable is we offer a product called OraKix, and what that does is lets us perform some periodontal procedures without the use of an injection.
You know, many people when they come to the dentist are also concerned about the radiation from all the x-rays. Tell us about how you've minimized that.
We use digital x-ray equipment. And the benefit with the digital x-ray equipment is it uses much less radiation than conventional film x-rays. It's about 90% less radiation than conventional x-ray. In addition, because it's digital and it's on the computer, we can manipulate these images and we find it better to diagnose problems.
Dr. Pomerantz fixed 6 of my teeth in one visit using the dental laser. No Novocaine, no grinding of the teeth. It was a wonderful experience, and I would recommend him to anyone.
Dr. Pomerantz, I noticed that you also treat snoring and sleep apnea. Is this unusual for a dentist?
I'd venture to say that less than 1% of dentists treat sleep apnea. It's certainly not mainstream.
What is the difference between snoring and sleep apnea?
Snoring is the partial closing of the airway while we sleep. As the air pushes up and down through the mouth and nose, the muscles vibrate and cause a snoring sensation or a snoring sound. Sleep apnea is the complete closing of the airway and preventing the patient from breathing. Sleep apnea is the most underdiagnosed medical condition in the United States today. Irritability, snoring, excessive fatigue are all possible signs of sleep apnea.
Is sleep apnea dangerous?
Sleep apnea is very dangerous. Very often patients don't even know they have this sleep apnea. Sleep apnea has been linked to heart disease, stroke, gastric reflux, cardiac disease, and many other issues.
As a dentist, what can you do to help people with sleep apnea and snoring?
Well, in our office, we fabricate an oral orthotic. And the premise to the oral orthotic is it prevents the jaw from falling backwards while we sleep. And when the jaw falls backwards when we sleep, it causes a collapse of the musculature and prevents airflow. So the oral appliance has two pieces to it and prevents the closure of the airway.
Now, is the appliance covered by insurance?
Most medical insurances do cover the appliance.
Are there other treatments out there for sleep apnea, and how do they compare with the appliance?
There are many surgical techniques that are used to try to treat sleep apnea, the most common of which, in its simplest form, is basically removing tissues from the airway to keep the airway open. The more common treatment is the CPAP machine. And the CPAP machine is a machine that's used to keep positive air pressure in the nose and in the mouth to keep the airway open. The problem with the CPAP machine is it's bulky, it's loud, it prevents patients from being able to roll over when they sleep, and the compliance rate with the CPAP is not very good.
My sleep apnea was very bad. Almost fell asleep behind the wheel numerous times. Tried CPAP, didn't work. Tried surgeries, didn't work. Then I found Dr. Seth Pomerantz. It worked.
Ever since Dr. Pomerantz made my sleep apnea appliance, I wake up in the morning a lot more refreshed, have a lot more energy during the day. It's just made my life a whole lot better. I'm glad I have it.
So there you have it, a look at 21st century dentistry. You have to admit, it's certainly come a long way in the last 15 years. For Spotlight TV News, I'm Tony Segreto.